Okay, hi everybody. Good evening and welcome to our last and final info session before we kick off the 2021 Texas Healthcare Challenge starting tomorrow night. So glad to see many of you on this call and glad to be discussing the topic, improving health outcomes. And we have a wonderful set of speakers here who are experts in this area, and um, we look forward to the conversation and also the interaction we have from you, our audience. We will be taking questions, so you'll be able to say, ask a question in the chat or raise your hand, and we will beam you in to hear from you. So I'm going to go ahead and share some slides here, and give me just a second. Okay, great. So tonight we are going to hear from our guest speakers. First is Jovelyn Castellanos, and she'll be followed by Shireen Abdullah. Both are leaders in the DFW area in healthcare on the Parkland Hospital side for Jovelyn, and then on the small business entrepreneurship side with Shireen, who runs a company called Yumlish. And before we get to our speakers, I do want to tell you a little bit about our event coming up tomorrow. We're super excited about. We want to recognize our sponsors that are supporting the event. Without their help, we couldn't run it. So thank you to all. As well, you can see the social links below. For those of you who are on LinkedIn and Twitter, go ahead and follow us, and you'll be able to see a live stream of many of the things going on this weekend. In our call, we have people who have registered for the event and those who haven't, and we welcome all of you. The registration is still open for tomorrow night, and we're looking forward to a great event. So the track themes that are part of this healthcare challenge, there are about 10 of them, and this week we have had discussions from experts in some of these areas, whether it's COVID related or mental health, and now tonight we're focused on improving health outcomes. As we have seen people register for our event, the tracks of interest were voted on, and as you can see, there's a strong interest in this topic tonight, improving health outcomes, with other areas like improving access to care and mental health top of mind for people who are focused on healthcare innovation and consumer-focused healthcare trends and new business models. Those who are attending our events come from a very diverse background. We have our programmer, software folks, and then we also have students and medical professionals and doctors, as well as business professionals who are in the mix, who can be on your team if you join and are part of the challenge. So it's a great way to network, obviously, but also to try to come up with some solution to a problem that's pitched in the healthcare arena. Those who are attending, some of them, most of them, it's going to be their first time. Some have attended before, and some are pros and have attended more than one. That's some demographics for you for our event. And the event is set up so that it's pretty simple to be involved. You obviously can see the information on our site. We have some signups on Google Forms that many of you have seen, and then the interaction for the challenge or hackathon experience will be alternating between Zoom and Discord. Discord is a bit of a mix between Zoom and Slack. It's some chat, some video, and it's a great way for teams to get together and virtually hack. And normally we do this event in person. Obviously we are distanced since this last year, but we're excited to bring a lot of people together and have a very successful event starting tomorrow. For those who are signed up, here's our schedule. So it's a 5:30 check-in with a 6 p.m. kickoff tomorrow night, and then teams will form. Saturday, we start up bright and early at 9 with a lunch break at noon and hacking all the way to 4 o'clock. So during that time, by Friday night, teams will be formed and they'll be off and running with final presentations starting at 5 p.m. that judges will view and pick winners. And it's a long weekend, but we have built in some breaks. It's tough to be on the computer for that long. Many of us know that this last year. We have great prizes for those who are involved, and we hope that this is a motivator, but not the only motivator to get you at the event and hacking and seeing if you can win. We also have some great in-kind prizes, IBM Cloud credits, and also some office spacing at Health Wildcatters downtown for when things open back up. And I know we are planning to have people come and rent space at Health Wildcatters, so we are offering some free officing there to some of the winners. Okay, so I do want to announce something that's going to happen after this event. For those of you who are registered and want to do some networking with other participants, this is a great opportunity. We'll have a Zoom mixer, if you will, where you can meet up with others who are attending the event and get to know them and see who you want to have on your team. So it's a great opportunity to network and to see who's going to be attending and check in with us. So that starts at 7:30. You should have received an email for that, and that gives you the registration information. All right, so before we begin with our speakers, what does improving health outcomes mean, and how do we position this topic with the various data points that are out there? Here are two items that I lifted from one of our blogs that can help craft the concept for you, our listener. So, this is an interesting one. In Texas, because of the language barrier that's out there and the limited English speakers, there are a lot of people who don't have the same access to health information as English speakers, and that's a real problem, and especially when you're trying to improve outcomes overall for the entire population. Another one from the Parkland Center for Clinical Innovation: health outcomes are impacted by social determinants of health, and these are issues that we'll talk about more tonight. So I don't want to go into too many of the data points and steal the thunder of the speakers, but let's go to that point now. So Jovelyn is someone who we know at Health Wildcatters. She helped with our Health Hacking Crisis Network this last year as a volunteer, and she's been influential in the community in healthcare leadership, recently getting her master's degree, and she's joined Parkland Hospital this last summer. So she's got a lot of work she's done already, and we're excited to hear from her. So I'm going to go ahead and stop sharing my slides and turn the time over to Jovelyn, who will address us. All yours, Jovelyn.
Thank you, Lance. I'm about to share my screen for the slides. Okay. Once again, thank you for the opportunity to both the Texas Healthcare Challenge and being able to just speak on a topic that's so important, especially with the pandemic going on. And like Lance mentioned, at Parkland, a lot of the community, we serve a lot of the community that's in that safety net. So a lot of the uninsured and a lot of different communities. So I did want to start off by talking a little bit more about Parkland CHNA. So what is the CHNA? It's the Community Health Needs Assessment, which is done in collaboration with the Dallas County Health and Human Services to identify populations that are at risk and that have health disparities, as well as medically underserved areas within the county. So most of these areas are uninsured and obviously have health disparities. And so this community health needs assessment looks at different areas and different needs, including the access to care and coverage, health disparities, special populations. And what that means is the elderly population, homelessness, LGBTQ, chronic conditions, diabetes, hypertension, asthma, and infectious diseases. And so these are just some of the areas that they look at. But these are the main 5 points that they looked at in 2019, which was they do it every 3 years. And so whenever we look at access to care and coverage, looking at behavioral health, we continue to see an increasing need of services, but those needs are not being met through the services provided within Dallas. looking at cultural competency, like kind of like what Lance was saying, we have such a diverse community, yet we don't have cultural and linguistically appropriate messaging and information that's easily read, and that information that's in the language of our communities, right? And access to care, Dallas County is one of the highest uninsured urban counties across the nation. But that doesn't come to a surprise, as you know, Texas has the highest uninsured rate across the nation. So whenever looking at socio-needs, which is the graphic that you see at the left, the CHNA uses the Socio-Needs Index, which is identified by calculating 6 different indicators, including poverty, income, unemployment, occupation, education, and language, which are all part of social determinants of health. And so these factors are basically kind of like the statistic that was shown that 80% of these are due to SDOH, right? The socioeconomic lens that a person is raised in is basically overall health, and 20% of it is basically receiving care. So a lot of the health comes from where you're raised, how you're raised, what do you eat, the school you go to, the level of education, your income, the family structure. So there's so many different social economic factors that play into overall health. And so what Parkland does is that they range zip codes according to these SNI indexes. So 4 and 5s are the ones that are darker colored. And so whenever looking at different initiatives within the community health department looks at how can we target these specific zip codes with the highest socio needs to really continue working in these areas that have such high disparities. And so kind of wanted to give just a brief overview of that and how the Parkland CHNA plays such a huge role in everything that Parkland does. And so vaccine hesitancy and Parkland efforts. So we know that with the vaccine being rolled out, there's a lot of vaccine hesitancy that comes with it just because of how quickly it was created, mRNA, and all of these different factors that play into this hesitancy that exists in our overall community, but especially within our communities of color, and overall looking at the why should we receive the vaccine if there's so many unclear answers to everything that's being said. All of the information, all of the myths that exist with this play into this vaccine hesitancy. So as of March 1st, there's 41 states that are reporting vaccine data by race and ethnicity. And there was a consistent pattern across states of Black and Hispanic communities receiving smaller shares of vaccinations. And so this can be interpreted in many manners, but whenever you look at vaccine registration, whenever you look at accessibility, whenever you look at information being available for individuals to register to receive the vaccine, do they have the technology? Do they have the transportation? So going back to those socio-economic factors that really play into this vaccine hesitancy, but also just overall vaccine availability, right? And with the factor that we are still in tier 1B and this rollout that we're having that's still being figured out. So there's a lot of moving parts to vaccine hesitancy, but some of the things that we've been working on, and specifically I've been working on with our team and with our department, because it's not just one person, it's all departments, it's a lot of departments, it's a lot of individuals working together, putting in our specific knowledge and also trying to move together as a team to really create this these projects, is outreach to general populations with a focus on higher risk groups. So whenever we look at vaccine hesitancy in Black and Latino communities, it's how do we instill confidence whenever there's all of these myths, whenever there's so much disinformation. So first of all, creating, addressing those myths. So we've created different materials that by listening to the community and hearing different myths that are existing within immigrant communities, Black communities, Latino communities, listening to those within different conversations that we've had with different organizations, different groups. and bringing that back into the system and saying, how can we use this information and make it in a way that we can create something that is going to inform our communities. We've also done a lot of community conversations with various groups, ranging from faith-based organizations to churches, to different coalitions, to different community groups, to continue that community conversation on the vaccine, and really having that open space where we have a Parkland staff come in and address these questions that our community members have. And also we've really tried to leverage our faith-based community as well, and saying, how can we, there's a lot of vaccine hesitancy behind some communities in terms of the faith-based. So how can we provide as much information, not forcing somebody to say, I want the vaccine, but just having the facts out there and clearing out all doubts that individuals may have. And so we also are trying to identify community leaders that are in the community, that are pastors, that are just really out there doing the footwork in the community, and getting them vaccinated under, if they qualify under Tier 1B, so that they can also be that voice within the community and being that champion of, I've received the vaccine, this was my experience, this is the process, and this is just having those conversations with a person at the market, at the gas station, and while they're receiving some type of service. So I think that as we continue moving forward, vaccine hesitancy isn't going to go away, but what we can do is continue educating our communities, continue providing those resources and those steps of how to receive the vaccine, but also where to receive the vaccine. And I think this is where it's going to be really important to go out into our communities according to these zip codes, to really be able to reach those individuals that are in that SNI index. And last but not least, making the vaccine available. As we continue with rollout, we know there's a lot of different factors contributing to the overall rollout of the vaccine. But I think, like I said earlier, having these vaccines available in a place where individuals can either walk to, or in a place where they feel safe, or where they feel, where they know, where they've interacted with individuals before, where they know the community. I think that's going to be a large part of that confidence being instilled into individuals receiving the vaccine that are hesitant at the moment. And lastly, belief systems, cultural belief systems that play a large role into receiving the vaccine. So how do we address these by instilling confidence back into healthcare, overall healthcare systems, and making sure that our communities are well informed of the services they provide. So, so this is just an overview, and you'll see a few flyers on the right of some community conversations that we've had with Dr. Roberto de la Cruz. We've partnered with Univision, with different, the Beat radio stations, with different media sources that we know our communities are in tune with, to really promote and also have that voice of confidence speaking about the vaccine, to continue instilling that confidence. So those are just some of the initiatives. I believe that also at the grassroots level, working with organizations hand in hand will be really useful when it comes to reinstilling that confidence and being able to say, I do still have some questions, but I feel a little bit more positive about receiving the vaccine. And so with that comes, education and the importance of health literacy. So health literacy is the way that a person receives an information, processes the information, and makes informed based decisions for their health and for their health of their families. So this is really important when it comes to a patient taking charge of their own health. How can we continue educating our communities? How can we continue educating through health systems, and including more of that cultural linguistic factor according to our different populations? So we know that adults with low health literacy levels have 4 times higher care costs, are 6% more hospital visits, and have 2-day longer hospital stays. So we also know that the United States overall has 30% of the population has lower than a low health literacy level. So how can we continue to increase that education portion within our limited English speaking populations overall to improve overall health outcomes for our families? And that's I believe that by educating and by providing those resources and really informing our communities of what's going on, it'll allow each family, each individual to really take charge of their own health and create those decisions for themselves, but also for future generations. And I'm going to end by this quote that I really love by Dr. Fred Cerise, and he said this in an article that was published in the New England Journal of Medicine through Catalyst, and says, regaining trust in medical systems and health interventions requires a commitment to show up in those underserved communities, listen to their concerns, and include their voices in addressing those concerns with the broader public. So as we move forward with any type of innovation, with all of these ideas and business models, it's important to also keep that voice and that eye and that lens of how can we also reach those underserved communities and include their voices in these models. And yeah, that ends my point. So thank you, and I'm going to hand it back off to Lance.
Great, thank you so much, Jovelyn. A lot to unpack there in terms of what work you're doing with Parkland, and we do have a couple of hands up for questions. We're going to hold off until the second speaker, but I do want to just comment a little bit on this, Jovelyn. So it looks like Parkland Hospital, it's Dallas County, it's their budget, obviously. They're really looking to make healthcare more efficient and minimize the cost of care by helping people be more engaged early on. And I'm curious to see, what brought you into that field. Did you want to work with Parkland as you finished up your master's degree? How did your career trajectory get you to where you're at now?
That's a great question. I've always been very passionate about the community, and I know that in comparison to other healthcare systems, Parkland really serves this as a safety net hospital, right? It's a public health system, and anybody who's uninsured, all of the uninsured, that's where they go. And so looking at it from how can we continue providing care? How can we continue taking care of our communities? I think that Parkland, through a community relations standpoint, that's why I decided to choose there. Even with the project that I did with Health Hacking Crisis Network, the volunteer, I've always been very passionate about that community. How can we continue advocating for our communities and for those that don't necessarily have the resources at the moment and don't necessarily understand what's going on, right? So sometimes whenever you're at a vaccine clinic, you see an individual being asked, are any of these, are you allergic to any of these, ingredients in the vaccine? And so they'll look and they're like, well, I don't know what that means. So increasing that, how can we have that equity and not only having the information available, but having them understand that information, and also for them to being able to say, okay, well, this is what I need to do for myself, not just because somebody's saying that I need to do it.
Well, I have a couple follow-up questions on the vaccine effort, and I'll wait till the end in our Q&A to ask that. Very interesting work. Let's go ahead and turn the time over to Shireen, who is the CEO of Yumlish. And again, we're going to hold questions till the end, but Shireen is joining us, and she has had some interaction with Health Wildcatters, being a part of our Texas Healthcare Challenge. I think a couple of years ago, your team was with us, and she's been innovating with her startup for a number of years now, and would love to hear her story. So Shireen, I'm going to just give you the floor and ask you to tell about your background with Yumlish, and I'll have a few more follow-up questions as we have a conversation with our Zoom friends here.
Awesome. Sure thing. So thanks so much for the opportunity, Lance. And I think that was a great presentation, Jovelyn. So I'm going to kind of speak from first as someone who received care And the gaps that I saw at that time, and then what led me to creating Yumlish and become the founder of this company. So it really started, quite honestly, a few years ago. Even before there was any thought of any Yumlish ever. It sort of started with being diagnosed myself with a chronic condition. I had at that time turned to my doctor, tried to understand from him what I could do differently in my health, to which he pretty much just told me, eat healthy. That was the end of that conversation. I didn't quite know what that meant for me. As a person of color, Lance, it seemed that nutrition in itself was pretty confusing. Everyone around me had an opinion on what to eat, when to eat, how often to eat. It just seemed like everyone was this unlicensed nutritionist around me, providing opinions. And after a while, they started conflicting with each other. And so it seemed like nutrition was this murky thing that some people felt like they figured out. And to me, it sort of seemed like, why is everyone just trying to figure this out? Why isn't there something like a go-to, especially when it came to ethnic foods? At some point, I was told that, oh, ethnic foods are just unhealthy. This demonizing of ethnic foods is so inappropriate and it's so disrespectful. And I feel that that exists and it really shouldn't. It shouldn't. And there are registered dietitians out there that will tell you that it shouldn't. And so that sort of got me on this journey of exploration, talking to multiple people, starting with friends and family. That was at first, that first tier of exploration, just asking them. There's instances of diabetes in my family, heart disease in my family. What is it that we needed? Is sort of that conversation started there internally, and then from there started growing out and sort of grew that circle step by step, talking to clinics, talking to nurses. So I was just this annoying person. If I had a doctor's appointment, I would go and I would strike up a conversation with nurses, with folks on staff, just trying to understand what was going on, where the gaps were. And so that's how this started. And just a little bit about my background. So I come from management consulting. So I come into this as an outsider, really. Spent years as a management consultant, solving problems for other people. And then I had this own problem of like my own problem, and realized that this wasn't only just me, and that there were a lot of people in the same position, just trying to recreate the wheel. And I joke about this: if you Google an illness long enough, you will ultimately realize, well, we're all going to die, so it doesn't matter. So anyways, it's going through this journey. Ultimately, I felt like there had to be a go-to resource, and that's what really brought me to this. Really created Yumlish with this intent in mind, to be respectful of cultural foods, respectful of people's tastes and preferences, and all of that. So created
Okay.
Yumlish with that in mind. And now Yumlish has really turned into this platform that provides cultural nutrition therapy. And we largely focus currently on Latinos with diabetes. And our overall mission is to really eradicate diet-related chronic illnesses by addressing sort of these social and cultural determinants in health.
Great, great. So your company really comes from your personal story, the problems that you were seeing with your own healthcare and your interaction with the system, and then your business model started to launch and evolved. And explain to us where you're at today. What does your company sell, and how do you impact the population from a socioeconomic or health outcomes focus?
Yep. So in terms of what we sell, so it is a service. We provide cultural nutrition therapy by way of registered dietitians. So real quick, it's a three-pronged approach to nutrition therapy. And so what we do is, in the first prong, we an individual who gets diagnosed with diabetes, their doctor tells them to eat healthy, we bring them onto our platform. And on our platform, what they receive is they get paired up with a registered dietitian who provides them this cultural nutrition therapy, taking into account their cultural heritage, country of origin, the foods that they eat, what they shop for. Takes all that into account and really guides them through. And that's truly where, and even to what Jovelyn mentioned earlier, that's an area that we're closing gaps in health literacy. And of course, with a strong focus on nutrition. We're going in there in this first prong and explaining to folks what A1Cs are. Why do they go to the doctor's office every 3 months and get this blood work done? What magic number is on this blood work that changes their medication? Those are the types of gaps that we see, in what we do, and that's really that first prong. In the second prong, we're addressing more of the socioeconomic barriers. So you can talk to a person about nutrition all day long, but how arrogant would it be if they don't have access to those foods? And so to that end, we provide them, we'll find them solutions. If it's a pantry, grocery, whatever solution is out there, we'll try to do the best that we can to close those gaps for them. And that's that second prong. In the third prong, we're addressing more of that behavioral. So this is where we hear individuals say, okay, I understand what I need to eat, but I'm still not going to do it. And so that takes a little nudging. And so to that end, we incentivize them using gamification, using peer support and social support. This is where they really encourage each other and uplift one another through their diabetes. So that's really this three-pronged approach that's multidisciplinary that's in place today. You also asked about the revenue model, in essence, Lance, and today it's a fee-for-service model. So we get reimbursement through CPT codes for these encounters that we have. Although from a long-term sort of sustainable standpoint, we're evolving more into that managed care space, into that population health space.
Okay. And so the question of who can get access to your platform, is that, are you selling to healthcare insurance companies? Are you connecting with hospital systems? Like, what's your go-to connection to the market, and how you get access to customers?
Yeah, so we go through employers and we go through health systems and clinics.
Okay. Gotcha. All right. And then some other questions here. How do you see things going? Like, how have things gone through COVID and this last year? Has your business model changed? How have you been responsive to people with the social distancing and trying to eat healthy so that they don't get sick from some kind of virus? Any of that play into your current business model?
Yeah, when COVID first hit, our model was still in person because we were trying out a lot of different things. We were still trying to understand what our model needed to look like. And of course, COVID hit and everything halted. And we're like, all right, can't do it in person anymore. And so we had to take this entire model that we had created and really take it virtual. In fact, as I speak to you, if I'm glancing over to my left, it's because we have a class right now that we're going through, and I'm just sort of like on the corner of my eye, just making sure everything is going okay. But that's what we've done now is just make this virtual. One of the key things that we did, I think that I don't think would have happened unless COVID had hit and we had no other option. We had an app. Right. So as a startup, I think we always, and to the ones who are aspiring founders on here, I would push that notion to say that go to being an app. Right. I think it's very easy to package something as an app and say, here we are. All transparency, we did the same thing. We created an app, spent a lot of money, time, blood, sweat, tears, everything in the middle, to create this app that we thought this is the game changer. And then we realized that adoption was low. People were not interacting. They weren't downloading the app. Forget interacting. They were barely getting folks to download. Our arrogance in this was to underestimate exactly these, how we would onboard someone. We didn't think through that. And so in doing that, we were literally sitting on the phone, and I joke about this now, but at that time it was a pain. But at that point we're, sitting with our patients on the phone, walking them through how to download this app on their phone. And the best conversation in the world is when you tell someone, okay, go find this app, install it. And then someone tells you, well, it's telling me my memory is full. I'm like, well, what do I do from here? And that's just it, right? You go through this and you take so much for granted. And sure enough, we left the app behind us, and we really pushed ourselves to say, all right, instead of getting folks to adopt this app that we have created, can we push ourselves to deliver what we do using what's already on their phones? And so today our entire intervention is on the front end, as far as the UI is concerned, is provided over a combination of WhatsApp, text messaging, and Zoom, which can also be accessed through a browser. So that's what that looks like on them. So on the front end, and it also does a couple of other things. Trust is a big thing for this community that we serve. For them, it is important to see and feel and recognize what they're using. Who is this random company that's telling them to download this random app? What kind of information is it collecting? They're used to these apps, the ones that we've sort of defaulted to now, and they trust it. And then by virtue of that, they trust us. And so that journey has been interesting. But on the front end, we've tried to keep it as simple as possible for them to adopt.
Well, that's great. It sounds like an exciting journey for you as a founder and finding your product market fit and finding ways to grow. So let's go ahead and turn to the audience and open the floor for questions. Again, we have questions that you can ask in the chat. You can raise your hand and I will call on you. You can just go unmute, or you can be on video, whatever it is. So it looks like our chat, someone here, Andres or Andre, they have a question. So, okay, Andres, go ahead and ask your question.
Hello, yes, good afternoon, everyone. Thank you so much, Jovelyn and Shireen, for the presentation. It's been such a great points as well. So, well, actually, you both talk about the importance of health illiteracy in patients, which is very common in underrepresented communities. And you also both made points in improving educations and resources for these patients, and especially those who don't understand what is a chronic disease or what is the impact of nutrition in other diseases, such as heart diseases and diabetes and all these kind of like tough diseases, to say it like that. However, yeah, I understand that Shireen, she made a really good point when she said about most of the diseases can be prevented by having like nutrition and understanding what kind of food to put on the table. So with this being said, my question is, how do you think we can address the issues of creating more resources for these for this kind of like a population that do not understand how nutrition works when it comes to manage these chronic diseases, and the perspective of these kind of like nutrition facts. So I think this question goes more like to Chua, because she kind of like were most based on nutrition. But I saw that Jovelyn also made a good fact. So whoever would like to answer, that would be great.
Okay, so
Thank you.
the question is around more resources, health literacy, and chronic diseases.
Yeah.
Shireen, you want to take it first, and then we'll jump to Jovelyn?
Yeah, sure. So as far as resources are concerned, I'll say this: there are quite a few companies that have been up and coming. So as far as understanding sort of this directory of resources that are available by zip code, they slice it and dice it different ways, but there are quite a few resources now. So if I would say, just to put some names out there. So there's Unite Us, which is a great company that I've recently heard of, and Bertha being another one. I think these new wave of companies that are sort of addressing SDOH in particular and bringing all these resources together are really going to be the key to unlock that. We see a potential partnership with a company like that because, again, right, when I talked about nutrition, can't talk about nutrition unless there's access to food, right? And so at the end of the day, I think these are the resources that will really come together. Now, that's not the only ones. In fact, I know of certain projects here in fact, in Tarrant County, there's a similar resource that sort of maps out where resources are available to an individual. They're local projects as well. And there's been some recent work in terms of research around that's been done. But that's not all of it, right? Like, it's not only that they don't know where these resources are. So that's just one part of the problem. The other part of the problem is, are those resources even available? People are in food deserts as we speak today, with all the websites that exist out there and the Google mapping of where these resources exist. There are people who are food insecure today. So I think it'll be a combination of understanding not only the, this directory of resources, but also on the flip side, having these resources more widely available and really bringing together those who are most impacted by people being sick as a result, right? So who does that mean? That really means the payers. That means, the ACOs. They're the ones who are sort of on the line for the risk of managing this population, and it will really take dollars from these different stakeholders to really move the needle on providing those resources as well.
Great.
Thank you. Thank
Jovelyn,
you so much.
anything to add to that?
No, I think everything Shireen said was amazing, and I echo her thoughts. I also believe that there's a lot of resources out there, kind of what you mentioned, Aunt Bertha. It's a great way to provide some type of model like that, and collaborate with organizations and really spread the word about that. But also, how can we provide the resources, improve education, and have that continuum of care, right? And I think we're going to be seeing a lot of community health workers. If we can find a way to bring in community health workers into resources and tying it all in together into a network, I think it's going to be really effective in not only addressing these health literacy, food desert issues, but also improving the overall health outcomes.
Great. Okay. We have another question, Kevin. Hold on a second. There's a couple links that were mentioned. So I heard Unite Us and Aunt Bertha. Jovelyn or Shireen, can you add those links to the chat? I don't know if you're on a computer, Shireen, or you, Jovelyn, but let's get the listeners access to those links. All right, let's hear from Kevin. You're up. You have a question. Okay, Kevin, your audio is a little bit scratchy. Is anyone having an issue with his audio?
Yeah, same here.
Okay, Kevin, you got a really weird audio, so I'm gonna have you type in your question to the chat, and we'll come back to you. I don't know what that is. Sorry. Okay, others. All right, let's see what the question is. Hold on a second. Don't see your message yet. We'll look for it in the chat. Any other questions? Raise your hand. But I do want to throw one in here for. Oh, let's see. Bistra, did you have a question?
Yes.
Okay, go for it.
So both to Jovelyn and Shireen, I want to say that while you were giving the presentations, there was a little bit of a dance inside me going on, because my pitch for the hackathon is actually about how we can build trust in the medical system through post-COVID work within the communities. So everything that you both were talking are things that I'm like, wow, that's exactly what I want to work with a team during the hackathon. I apologize if that was a little bit of a pitch promotion, but especially when I saw Jovelyn's final quote from the CEO of the hospital, that the trust in the medical system is by meeting the communities where they are, is really what I see as a recovery and building up trust in everything that Jovelyn works and the promotions that they do in order to bring, and also Shireen's nutritional perceptions. As Shireen said, we use what the communities trust. And I recently read that Rochester, New York had a massive marketing promotional PR campaign to bring underrepresented communities to vaccination site, and it failed. Failed because the people who are doing the outreach were not people from the communities, and they didn't know the people. The people didn't trust them, and it just made me think. And what you were saying tonight was exactly this. You need to have connection with the people in the communities, not only linguistic and cultural, but you really have to have the trust through the channels that they use in order to have the long-term effects. It's not only vaccination, it's long-term resolution of social determinants of health and health outcomes. So I don't know if it was more question or comment. I was really excited to hear the presentation of both of you and what you're already doing, and kind of feel justified that what I'm thinking is actually on the right path of ideas. I would be more than glad to hear your opinion and comments about the idea of trust and how you use it in your work, because I think it's very, very strong and important.
Okay, great question about trust. Shireen or Jovelyn, any thoughts on that? And then Tony has a question, and then Kevin is prior to Tony.
Jovelyn, I'll let you go first if you'd like.
Yeah, absolutely. I think trust it's a very important thing to have whenever looking at receiving care. Kind of what Shireen was saying earlier, on WhatsApp, a lot of the Latino community, they're all over the Central America. That's what they use to communicate. So trust in a way that we can continue communicating, and also building that trust by being that voice in the community and going out to different organizations and saying, this is who we are, this is Parkland, these are the services we serve, or with your business model or with your app, being out there in the community and building that trust, and using the platforms that they use, using the radio stations, kind of what we're trying to do, of instilling that confidence in the vaccine. Univision, using networks where individuals watch the television, they listen to the radio, they recognize individuals receiving the vaccine. So building that trust is really important whenever trying to reach our communities, and also continue that trust within our healthcare systems.
Yeah, just last 2 cents on that. And am I pronouncing the name right? Bistra, is that correct? All right. Bistra, if you're not going to promote your pitch, who will? So keep promoting it. And just to go back to your question, as far as building trust is concerned, I mean, absolutely, right? I think that trust is ultimately going to be important for anything that we are doing as far as, sort of reaching and creating an impact is concerned. So trust is going to be key to that. The way you establish that trust, though, will be through, how you disseminate that information, how you collect information, how you secure that information. I think there are levels of trust to build. It'll come one at a time. You're not going to try to solve everything overnight. But what you have to keep doing is you have to keep listening, right? So I think as anyone who is early stage, my biggest thing would be to just keep listening and understanding what your target population needs, right? How can you establish trust with them? What are they using? Where are they going? Where are they shopping? Right? Like depending on sort of how you're, not knowing your pitch entirely, but depending on how you're approaching that, building those things that are familiar, build in what they know. And from there, trust and linking that ultimately to trust will be a lot easier.
Great. Okay, thank you. Let's go back to Kevin's question in the chat. He says, what is one effective way you found successful in dealing with people who may be lying to themselves on how healthy or unhealthy some foods are that they're eating? I feel like a lot of people convince themselves that what they're doing is okay or even good. Wow. Okay. So misperceptions in what is healthy, there's some cultural element to that possibly. And I think Shireen, your company's saying, hey, just because it has this cultural background doesn't mean it's unhealthy. You know, you can have some angles there that work. So the question is, how do you scare? No, he didn't say how you scare people, but how do you effectively deal with them when they may not be honest about eating healthy foods?
Yeah, so I think that's like there's two things there, right? So one is if you don't know something and you're making a decision, you know, to eat, and I'm just, you know, to load up on all the culture, all the tortillas in the world, right? You may not, if you're coming from a place where you don't have that understanding, that is one thing. The other is a place of denial. Now that is more behavioral, right? And so if we're talking about changing diets, changing the number of tortillas, for instance, that you're eating, that comes from a place of education to say, listen, you don't have to be scared about this change. We can work with you through this change, right? So again, creating that trust and understanding, I'm not here to take your foods away. I'm here to show you a path forward that can help you get to better health. And I think once the conversation shifts from you have to do this to now that person is participating in their health and you're actually empowering them, that changes the conversation because it's no longer, you know, it's not essentially saying I'm superior and you don't know something, but it's saying I'm empowering you. What are you going to do with this information?
Okay, very good. All right, Tony is up. He has a question for us. Tony.
It was really, I mean, it's kind of a long-winded thing, but one of the things I'll share with you is part of the work that I'm doing is we know with the literacy problem, this is more in Jovelyn's wheelhouse, that there are about 65 million people in the United States that have a literacy problem. That means that they're reading somewhere between the 5th and the 8th grade level, something to that effect. And a lot of this trust that you're talking about, how do you get into minority communities and get these people to trust you and believe that what you're telling them about a vaccine that came along in 9 to 10 months is healthy when other vaccines have taken many, many years to develop. I think when you talk about going into the communities, like going to the churches or the radio stations or wherever these people are, and basically you just try to, I guess, directly access them through that medium, that doesn't automatically instill trust with them. Most of them are going to feel like the main reason why some of these people felt badly about vaccines in the first place is because they were tricked somehow or another, you know, to take a medication or whatever the thing is. A lot of people don't even trust flu vaccines. But I think what we need to do, if you want to educate them, is you really, really have to talk about what the issue is. Nobody understands. If you've had Ebola and several other major viruses that were out, why is this one able to be made in 9 months and the other one's taking 4 or 5 years? You have to close that gap in your education. You have to talk to them about why is the science okay here when it only took 9 months? And then why did it take so long over here to get it done before? And then more importantly, is this the new way that you guys are doing it? Are you only doing it for COVID-19? Because that is what's going to get traction to getting them to believe that there's something not wrong with this virus. You have to address why there's this gap in time and how we developed it. And why do they do this for COVID and they didn't do it for other viruses or other plagues or other things when they also had the same resources to be able to do it? So you got to get over that hurdle. Then I think the second thing you've got to do, once you tell them how we did this and you explain to this how this is going to help them, is the people that need to get that information. If you're going to go into these communities and get pastors and get radio DJs and get celebrity types and community activists or whatever they want to be called, you're going to get these people to talk to those folks. You can't talk to them on a superficial level. Just saying, oh, I'm someone that you know, I got the vaccine, you take the vaccine. That's not going to work. What has to happen is you got to educate those people to be able to say the very same thing that I'm just sharing with you. Have those community people explain to their own communities what the difference was. Why is this one safe and it got done in 9 months. That's going to be the big hurdle. Why is this one safe? It only took 9 months. The other ones weren't. What did they do differently here? And why does it make sense for me to take it now? And because all you do is get these people to pop up and say, take the virus, the same people that distrust that are going to say, well, they're paying them off, or they're getting something for it, or they're part of the problem. You know,
Okay.
that's where they're going to go, because they're already there. Because the majority of these people that are going to have a problem with this vaccine are the very people that are also dealing with a level of illiteracy. They're not, the doctors and all these people are talking over the heads of the audience already, just to begin with. When you listen to these people talk.
Okay, Tony, our call is ending here. So it's an issue of trust. Jovelyn, do you want to chime in on this one?
Yeah, I'll do it really quick, briefly, since I know we're hitting the mark, but those were great points, Tony. Something that we do through those community conversations is we have medical staff or some representative that has knowledge of the vaccine to really speak on it. And so some of the questions that the community does have through those community conversations is, will my DNA be changed due to the virus? And so they'll address questions like that within those conversations that we have that are usually an hour long. And so a lot of those questions are answered through those community conversations. So it's a multi-approach that happens, not only community influencers, but there's also that community conversation component, and also trying to stay our nonprofits and organizations, try to keep them informed of what's up to date with information. Thank you, Tony.
Okay, guys. Well, we're gonna close up here. Thank you all for joining us. We thank our panelists, Jovelyn and Shireen, for providing their expert opinion and thought on this matter.